Most of the diabetes that we have found are diagnosed when there were no symptoms at all. It does not mean that if there's no family history, you're free of diabetes. Many of us generally don't tend to give importance to physical activity because most of us are working in offices and have some sort of a sedentary lifestyle. Basically, diet, a good diet, a diet which does not have too much of glycemic agents in that. But physical activity plays a major role, whether it's just plain walking. Some claim that 10,000 steps in a day would suffice. Yeah, it can suffice. Or having a short, small kind of a stint of exercise or a sports. But definitely physical activity plays a major role. Long-standing diabetes, if you keep monitoring HbA1c value over a period of say years or months, it gives you an understanding of whether the patient has been able to control the diabetes good, better or not.
Hello and welcome to the very first episode of Diagnosis Matters because every test tells a story, a podcast series by Transasia. I'm your host, Dr. Poonam Lalla, and on the occasion of World Diabetes Day, we're going to talk about a condition that affects millions across the world, and that's diabetes mellitus. But today's discussion is not just about the disease alone. It's about early detection, right diagnosis, and how timely testing can make all the difference. To help us understand this better, we have today with us Dr. Suvin Shetty, who is also a leading expert in laboratory medicine, and together we will explore how diagnostics can help understand diabetes and patient care better. Hello, Doctor. Welcome to the podcast on World Diabetes Day. As you're aware that India is becoming the capital of diabetes on the global front, and we have the younger generation getting affected by diabetes. How important is early screening, and especially for the people who do not have any signs and symptoms?
In fact, it's highly desirable to have a early screening. The whole point, sometimes we think that diabetes is disease and has few symptoms which are very commonly available in literature, but most of the diabetes that we have found are diagnosed when there were no symptoms at all. It was more like incidental. So right. Many of the cases we possibly have missed out and we have lost a lot of years or months before the diagnosis was made. And by then some damage or the other has happened to the patient. So it's all the more very important for the youngsters also to undergo diabetic diagnosis, and L-check doesn't limit to only the elderly population. It should be true, especially when it comes to diabetes.
Absolutely. So what is the role of family history and lifestyle in developing diabetes?
Very important role. Many of the such diseases as such like diabetes is very closely related to the family history. Apart from the fact that there will be genetic predisposition, there also will be the fact that the familial environment, which constitutes physical activity, which constitutes diet, will also play a major role in the diabetes manifestation. So it is important, but you should always bear it in mind. It does not mean that if there's no family history, you are free of diabetes. Diabetes will still can be manifest if the various factors are still in play. Family history definitely plays a major role, though.
Absolutely. Since we are talking about diabetes detection, what exactly is HbA1c test and why is it considered as a gold standard when we talk about the testing?
Whole point about HbA1c, if you look at the chemical understanding of the particular test, it's not a very labile kind of a parameter. It is basically a glycosylated hemoglobin which records itself, manifests itself of the glucose level over the past few months, 2 to 3 months. So it gives you a consistent value of how the glycemic control or the glycemic value was there for that particular patient. Whereas when it comes to plain glucose monitoring, it will change second to second and minute to minute. So in that sense, HbA1c has become like a very strong parameter to test or diagnose diabetes. Apart from that, you have very good methods, solid methods, which are very standardized, and there are references which are available, which helps us to push for the diagnosis of HbA1c as a gold standard. And more importantly is we don't require any preparation. Like if it is a plain glucose, the values will change based on what the patient has or add as a meal. That will determine the glucose value. Whereas HbA1c, that is not a determining factor. So you can do the test anytime through the day. So all the more reason for this particular parameter to be a gold standard.
Right. As we're talking about the test, doctor, how do accurate diagnostic devices and the lab testing improve the treatment outcomes, especially for these diabetic patients?
It's very important because finally diabetes is a diagnosis of the labs. It's not a clinical diagnosis. It's a laboratory diagnosis because you're testing glucose, you're testing HbA1c, and you're testing other areas where the diabetes may have got affected. So it's purely a laboratory testing by which the diagnosis is made. But hence, more the accurate the lab testing platform, more accurate would be the performance of that particular test, and more accurate would be the diagnosis of the disease.
Now, talking about the younger generation, we were saying that more and more people are being diagnosed with diabetes. So what preventive measures would you recommend?
Way to prevention of diabetes is plain. It's basically diet, a good diet, a diet which does not have too much of glycemic agents in that. These are easily available in the literature or in the Google search, what kind of a diet, and everyone knows about it. But diet plays a major role. Family also plays a major role. As I said, environment, the way the diet is there, and some genetic predisposition. But apart from the diet is the physical activity. Many of us generally don't tend to give importance to physical activity because most of us are working in offices, have some sort of a sedentary lifestyle. But physical activity plays a major role, whether it's just plain walking. Some claim that 10,000 steps in a day would suffice. Yeah, it can suffice. Or having a short, small kind of a stint of exercise or a sports. But definitely physical activity plays a major role.
Since you have said about diet and exercises can make a change, can these lifestyle changes alone reverse the early stage of diabetes?
Absolutely, absolutely. In fact, we should always articulate this to the patient that diagnosing early diabetes or pre-diabetic stage should always be encouraged, so that we don't move and encourage, and we should elevate the fear that patients may have whether this leads to medication. It doesn't lead to medication at the first instant if the glucose is not very high. Medications come in play when there's a long-standing high glucose level or very, very high uncontrolled glucose, that time. But early changes or early diabetes, definitely diet and exercise or decent amount of physical activity is very much possible to reverse the diabetes.
Thank you, sir. Now, talking about the lab monitoring, do you feel that a regular lab monitoring is more reliable when we talk about the self-diagnosing gadgets or home testing devices?
See, lab does play a major role when it comes to, say, diagnosis or at times even monitoring. But definitely we cannot, and WHO definitely encourages self-management or self-testing of oneself, either using glucometer or nowadays you have the ambulatory glucose monitoring level. Though there may be possibility of some accuracy issues there, but nevertheless, if there's a patient who's on insulin dependent kind of a diabetes, a continuous monitoring of glucose is nevertheless important, and that's not possible via any of the lab test means. It's possible only using ambulatory glucose monitoring, right, or glucometer at times. Lab has its own role, whereas it is about screening, it's about testing, it's about diagnosing, and at times even monitoring, But continuous monitoring, you will definitely need an ambulatory glucose monitoring.
Valid point. So, one more thing about early detection. When early detection of elevated HbA1c can really help prevent diabetes-related complications like neuropathy or nephropathy or retinopathy.
Yeah, it will, because at the end of the day, HbA1c is a good parameter to test because it gives you non-diabetic, it gives you pre-diabetic, it gives you diabetes as such as a diagnosis. And long-standing diabetes, if you keep monitoring HbA1c value over a period of say years or months, it gives you a understanding of whether the patient has been able to control the diabetes better or not. And a long-standing diabetes or chronic diabetes over a period of say few years will causes the damage to the organs such as kidney, eyes, and so on. And nevertheless, when you are testing yourself on HbA1c platform, you know okay, what kind of a value is there. So you know what control needs to be there.
Right, right. As a healthcare professional, what one message would you like to share on this Diabetes Day with our viewers?
See, the theme of World Diabetes Day this year by WHO has been about diabetes and life stages. That means diabetes affects each and every aspect of our life, whether it's childhood, whether it's reproductive years, whether it is working age like all of us working professionals, or even the elderly late adulthood. It affects each and every aspect of life. So we need to take this particular theme to back home and derive the fact that we need to test ourselves, screen ourselves at the right time so that the diabetes can be controlled at the outset itself. Thank you.
Thank you so much, Dr. Suvin, and it was a good message from you on World Diabetes Day. Diabetes is not just managing your sugar level, but it's about understanding what your body is trying to tell you. Every test, every number has a story behind it. A story of prevention, awareness, and better health. On World Diabetes Day, let's remember, testing on time can save a lifetime. Stay tuned for more insightful conversations right here on Diagnosis Matters, where we decode diseases, simplify diagnostics, and bring you stories that truly matter. Don't forget to like, share, and follow us for the upcoming episodes because every test tells a story.